Welcome everybody. My name is Nicole Holden. I am a doctoral student at Liberty University, and this is my demonstration for the 725 Teaching and Learning class. Today we're going to go over a curriculum that I have developed called Hair for Healing, and it's a cognitive-based health and wellness coaching training program, and it's for professionals who are working with clients with hair loss. First thing that I want to do is I want to go over the learning objectives. By the end of this course, you should be able to identify what your role is going to be as a health and wellness coach. You're going to be able to analyze and identify the need for health and wellness coaches in the area of hair loss, because this is a brand new area that we're venturing into. You're going to be able to assist clients with recognizing and identifying the thoughts, the attitudes, and the beliefs that's associated with hair loss. Apply their knowledge as a health and wellness coach to help clients with new ways of thinking. Okay, so you want to take what you know and then you're going to apply it, and then you're going to be able by the end of this course to demonstrate the knowledge that you have to develop a plan for working with these clients and helping them to achieve their goals. Okay, and we'll learn more about that in a minute. So I wanted to tell you a little bit about the program. So Hair for Healing, it is a cognitive-based program. I do have a background in cognitive programming. I found it to be very effective when it comes to changing people's thoughts, their attitudes and beliefs, and hopefully they could work towards getting a better outcome for what it is that they're trying to achieve. And so this is a program that is cognitive-based, but it's specifically for individuals who are dealing with hair loss. Okay, and so some of the people that might take this course might be people like you guys, because I know we have a counselor in here, a stylist, and also somebody who has a lot of people in their life who is dealing with hair loss, and they want to be able to, assist. One of the things that I want to go over is that we're going to use the word alopecia and hair loss interchangeably, okay? Because alopecia is just the medical term for hair loss. All right, so men and women both suffer with alopecia, and they can develop symptoms of depression and anxiety, and they could benefit from the support of a coach. Can y'all see how people with hair loss can develop symptoms? Like, what do you think somebody might display that might seem like they're struggling emotionally because of their hair loss?
Not wanting to show their hair.
Yeah, not wanting to show their hair.
Yes, wearing wigs, covering up their hair.
Yeah, wearing wigs. So those are things that they're doing. Those are some of their behaviors. So what might some of the feelings that they might be, how do you think somebody might feel?
Lashing out.
Insecure.
And very, lashing out, right.
They might lash out, be short-tempered, insecure. Those are really good answers. All right. Hopefully we can help our clients feel more comfortable, because a lot of clients, what they do is that they go to stylists first when they're dealing with, especially women, right? So women might find a spot in their hair, they really don't know what it is. So the first thing that they'll do is that they'll go to their stylist and they'll try to cover it up, right? With some men, one thing that they might do is comb it over, get a toupee. They might even invest in, getting hair transplants, right? So those are some of the things that we do. So as we say, it's more the stylist that you go to, but are stylists really equipped to deal with the emotional issues that might come along with losing hair?
Not really, no.
Yeah. No, not really, right? And so not only that, let's say somebody is dealing with more emotional issues, and because they have these unexplainable emotional issues, they might be seeing a counselor, right? But they might not necessarily be able to express to the counselor that this is about hair. And even if they do you think most counselors are really knowledgeable in the area of hair loss or issues with hair?
Not if it's not their profession, no.
Right, and that's a good point, if it's not their profession. So what we're trying to do is we're trying to make this a part of their profession, for the stylist, for the counselor, and even somebody who might not specialize in those areas, but they're looking to be a life coach. They're just looking to be there to somebody to help, to provide them and help them, coach them through this. So upon completion, students will become certified health and wellness coaches specializing in hair loss. right. Let's go through. All right. So, okay. Okay. I'm having a little bit of technical difficulties. I was going the other way. So let's get back on track. All right, so we did go over a little bit before you got to this class. There was a pre-test, so we're just gonna go ahead and review and make sure that you learned the stuff from the pre-test with a quick quiz. This is something that you're just gonna go out as a group. It's gonna be a group activity, which worked well with adult learners. So you guys, as you know the answers, you could just shout them out, okay? And then I will test your knowledge. So, alopecia is the partial or complete absence of hair from areas of the body where it normally grows. Is that true or false?
True.
True.
Oh, okay, you got it. Excessive crying, feelings of hopelessness, social isolation, and repeatedly going over thoughts are all symptoms of what?
Depression.
Okay, very good. Having a feeling of worry, nervousness, or unease, typically known as imminent event. Having a feeling of worry, nervousness, or unease, typically about an imminent event or something with uncertain outcome, is known as
Anxiety.
Oh, look, I didn't even get to get the multiple choice up, but you're right. The choices were PTSD, alopecia areata, C, anxiety, or D, none of the above. But y'all scholars in here, so you knew that the answer was anxiety. Very good. So thank you, because now I know that you're ready. All right, so we're going to talk about your role as a health and wellness coach. So one of the things I want to ask you before, by show of hands, have you ever dealt with anybody, either personally or professionally, who has dealt with any forms of hair loss?
Yes.
Okay. So, do you understand the importance that it is to have somebody in your life who might be dealing with those issues, like help guide them? I mean, do you find that it could be something that might be debilitating or, just really interfere with somebody's quality of life?
Yes.
All right. So, your role now that you're going to be certified as a health and wellness coach, you're going to be able to provide your client with support for issues regarding hair loss. You're going to be able to help your clients gain a better understanding of hair loss, help them to uncover their negative core beliefs, and we're going to go more into the negative core beliefs in a little while. You're going to be able to help the client to recognize the symptoms that they are experiencing in relationship to the hair loss, challenge the clients to identify and verbalize their thoughts about hair loss, because one of the things is that some people might have feelings or they might have attitudes, but they might not be able to actually verbalize it. They don't know how to express it. They don't necessarily know what it is. All they know is that they might be feeling a little differently. So we're going to actually work with the clients to be able to recognize what it is that's going on with them and to verbalize it so that they can get the help that they need. Once we uncover that, we will show you how to be able to discuss with your client that the attitudes and the beliefs that actually lead to having negative thoughts, because negative thoughts usually stem from something that's lying beneath the surface. Okay, and then ultimately we definitely want to develop a new way of thinking and a positive course of action, because the thing about living with hair loss is that there's really no cure. Now, we can treat the symptoms. They might be able to prolong it. People find ways to hide it, but ultimately, no matter what it is that you do, you have to learn how to deal with it. So that's one of our goals, is to have somebody live a good life, even though that they have to live with this condition. You follow? Okay. Are you excited?
Yes.
Okay, great. All right. So the technique that we use for Hair for Healing is actually called the coach approach. Okay, so this is going to be the tools that you keep in your toolbox. This is what you're going to do. This is what it is that you're going to do anytime you're dealing with any client who's dealing with it. If you follow these, follow this approach with any of your clients, because some people, their issues, their concerns, and their goals might vary, but we're always going to follow the coach approach. Okay.
Mm-hmm.
All right, so the coach approach. You're definitely going to identify and verbalize the thoughts surrounding hair loss, okay? So you're going to work with the clients. Now, we will give you tools and handouts, which you'll get in a full package. This is just a brief version of the program, but you'll get in a full package. We'll give you the tools, we'll give you worksheets, but ultimately, all of those activities will work towards the identifying and verbalizing the thoughts. We're going to recognize, identify, and then verbalize the feelings associated with the thoughts about hair loss, and then develop new thoughts to challenge the negative thoughts that surround hair loss. We're going to discuss attitudes and beliefs, and then we're going to develop a personal goal. Okay? So, your role, okay. Let me just explain this. Me with this PowerPoint, I'm a little challenged with it. I really prefer to talk to you, but I want to make sure that you have it. So just pardon me if my clicker goes a little back. I'll get it on track. All right. So I wanted to give a case study real quick, 2 examples. So one example, especially this is for the counselors, we had an issue of a guy who was about turning 40 years old, and he began to experience hair loss. And because of this, it was causing him, he started showing like really negative thoughts. He had a lot of fear, a lot of nervousness. He was displaying a lot of issues with anxiety. And so thankfully with him, he was talking to a counselor. And so the counselor just so happened to ask him, what happened in your life? When did this start? And he said, well, he noticed that it started when he realized that his hair was, he was losing his hair. Well, in the process of losing his hair and being young, he started working with the counselor, and he discovered that his father had lost his hair early, but his father also died at an early age. And so working with his counselor, they were able to discover that this particular client was associating hair loss with death. And so for him, he started believing, now that I'm losing my hair, I must be ready to pass away soon. And so now that he had developed, those underlying issues that we talked about, now they were able to move forward with it. So with him, it wasn't necessarily hair. It was actually how hair loss related to him having, death anxiety. And so do you see now how this, this works out? So in that case, we want to work as health and wellness coaches in this area to help people uncover some of those things, because he's panicking about one thing. Now, do you think with this client, if he would have went to a stylist who would have gave him a good haircut, maybe, or a comb over to cover up his hair loss, that would have helped his symptoms?
Not at all.
Because his symptoms definitely ran deeper than that, right?
Right. Going to a coach, he was able to uncover certain things about himself.
Absolutely. And so that's the importance of it, and that's what we do. We will be exploring the depths of hair loss, and there's emotions attached to hair loss that might be, a little deeper than most people know. And then the clients, they might be able to work on addressing those issues. Another study, we had a case study, was on a female. And in this particular case, the lady was going to her hairdresser, and who she would go to faithfully, because she was experiencing a little bit of, hair loss, so she would get her hair done. And like most women do, they would talk to their stylist about whatever issues that she had going on. Well, in talking to her stylist, she spoke about how she wasn't that comfortable with, her hair, so she really doesn't like to go out too much. And this is now causing a problem in her marriage, because her husband will invite her someplace. He feels like she's losing interest because she doesn't want to go out with him, right? So they begin to argue, and this is all stemming from her hair loss. So, but she hasn't verbalized it to him. So now, what do you think she might be feeling about her hair loss? Like, what do you think of some of her feelings associated with her hair loss?
She's losing her femininity.
That's a great one. She's losing her femininity. Any other ones?
Her spouse might not look at her the same.
That she might be feeling like her spouse might not look at her the same, right? And so if people feel like that, what are some of the actions that come? If that's their thoughts, what are their actions now?
Withdrawal.
Their withdrawal.
Yeah.
And then what did you say?
No, I was actually piggybacking off what she said.
Yeah, they'll withdraw.
So,
And that's really a great one. So I just want to write down some of your responses because they were really good. So one of the things that we said that her feelings, and what did you say that her feelings might be?
Losing her femininity.
Okay, so we said that she might be losing her femininity, right? So will we consider losing her femininity a thought or a feeling?
A feeling.
Okay, it's a feeling. All right, so how do we know that it's a feeling?
She hasn't verbalized it.
But is she thinking it in her head?
Yeah.
Okay, so she's thinking it in her head. So one of the things that I want to uncover, and this is what we're definitely going to be able to do in the program because it is cognitive based, is that we will be able to differentiate the difference between thoughts, which is in our heads, feelings, which we feel in our body, and then what we demonstrate as far as our behaviors. So some of the thoughts that she's actually having, because it's starting in her head, is that she's losing her femininity and her husband might not be looking at her the same. So I'm just going to put that in the thoughts area for a moment and I'm going to show you why. All right, and before we go there, we already talked about what her actions were, right? So her actions was what? That she was what? Withdrawing. Okay, so I put feelings here, and the reason why, and this is what we're gonna do as a coach, is that we wanna make sure that we know the difference between thoughts, actions, and feelings. And so feelings is what we're feeling. Now, if you're feeling like you're losing your femininity, right, or your husband may not look at you the same way, tell me some of the things in your body, like how do you know that's what you're feeling?
You're not feeling attracted. Well, you're not by speaking to someone.
Okay.
About your feelings.
Okay. So by speaking to someone, so let me ask you this question. So if you feel like you're losing your femininity, right, and then your husband asks you to go away with him, those are symptoms. She might be feeling a little bit of what, like anxiety, right? Anybody in here know what anxiety feels like?
Anxious.
Right, she's feeling anxious. So if you're feeling anxious, what are some of the things that you tend to feel in your body when you're feeling anxious?
Nervousness.
Okay, and what does nervousness feel like?
Trembling. Can't speak. Tightening of the throat.
Okay, tight throat.
Pacing back and forth, like you said.
Okay. Oh, wow. Can't spell throat. Wrong. Okay, we got it. All right. H, let me put an H in there. Okay, we got it. So, so what it is that some of the things that we feel, and we want to definitely make sure that our clients learn how to be in tune with their bodies, because that's a big thing when it comes to cognitive behavior. Learning how to be in tune with your thoughts, and this is how we use, to recognize what we're thinking. Definitely, our feelings, what we're feeling. What is it that we're feeling in our body that actually lets us know that we're nervous? What do we feel in our body that lets us know that I'm not okay with that? Those are the things that we want to be in tune with. And one of the reasons why I want to make sure that we help our clients to identify that is because we can start asking, if they can't answer a question, we can ask another question. Some people don't know that they're feeling anxious. Some people don't know what anxiety or depression is, right? But they might be able to go back to a time when they had these feelings before, right? So we can ask the lady, okay, so I'm her stylist and I'm doing her hair. I'm not a professional yet until she becomes certified as this wellness coach, right? But she's going ahead and she's doing her hair, and the lady is saying to her, every time my husband asks me to do something, I don't know, I just have these feelings. I just feel like, I don't know, I can't explain it. Well, what do you feel? I feel nervous. Well, what does nervous feel like to you? My heart start racing. Have you ever experienced that before? Think about a time in your past when you've experienced that before. So the client might say something like, only time I ever remember feeling this nervousness was before I had to get on a roller coaster. I hate roller coasters. It makes me so anxious to get on a roller coaster. I mean, just the thought about going to an amusement park used to cause me what? Anxiety, right? And so now that person might not have been able to identify that this was anxiety in relationship to how she feels about her hair and how she now responds to her husband. But because we helped them to work through that and identify how they felt, what they thought, and now the actions, because she didn't want to go to the amusement park just like she don't want to go to, go out with her husband, that's how we help them to start recognizing what's going on. And that's how a stylist can help a client, because don't you think having that conversation, working through, and think about it. If this client is coming to you, twice a month at minimum, think about the relationship building that you have. They obviously trust you because they talk to you, right? And one of the things that will separate you who are stylists in this room is that if we don't know the proper way to respond, right? If we respond in the wrong way, we could really not earn that person's trust, right? So imagine if you have this lady who's already coming to you, and the lady's already telling you that she doesn't feel great, right? She feels a little insecure. She feels uncomfortable going places. And here it is, she confides in you and you brush her off, or you say anything wrong or anything to make her feel uncomfortable. What do you think she's gonna do to you? She would withdraw.
She was withdrawal. You can make the matters worse.
Yes.
And because you gave her a negative response.
Mm-hmm.
Yeah.
Yeah. So, and then this is something that she has to live with. It could really make the situation worse.
Yeah.
So this is one of the things. This program actually levels the playing field when it comes to who the professional is and what they're capable of. It's great for anybody, a stylist, a coach, a friend, a family member, anybody who wants to be certified in this program. All right, so another thing that we do is that we work with helping the clients to recognize the sphere of influence. All right, we can't control everything. Okay, that's one thing. We are not here to, I know it says here for healing, but that's a play on words. There's certain things that we can't heal. There's certain things that we can't control, but we're definitely just trying to give them a new perspective, help the clients to uncover their negative thoughts and feelings, and develop a new, a new way of thinking. All right. So part of what we do as an activity is to recognize the spheres of influence, the things that we can control, the things that we can influence, and the things that we can't influence now, but we may be able to influence later. So I want to use a quick example. Let's talk about somebody who has chemotherapy induced alopecia, right? And that's somebody who loses their hair because they are a cancer patient. Can they control at this moment? I know they're working towards their goals, but can they control having cancer?
No.
Okay, so we already know that that's something that they cannot control. But they may have feelings of insecurity now, right? Especially if this is somebody who's had a lot of hair, or their hair was their glory, and now they're wearing a scarf because why?
Because they're embarrassed, ashamed.
Right, I love those words, because they're embarrassed, because they're ashamed, okay? And so the action is what? Now they're covering up their hair, right? Is that something that they might be able to control?
We're covering the hair?
Yeah.
Eventually.
Eventually, that is something that we gotta help them work towards
Right.
it, right? Because they might not be ready to take the scarf off just yet, but that's something that you could work on, and that's a small goal. So when we talk about goal setting with your clients, that's a goal that somebody could have right there. The goal right here is taking off the scarf or uncovering. All right, so uncovering hair. So now we're gonna show how we can help to change that. So one of the things that we could do as a coach is let's work on the things that we can influence, right? Can't influence your hair, can't change your hair, but okay, as a female, besides your hair, what are some of the other things that you tend to dress up to make yourself look or feel good? Makeup, right? Okay. So putting on makeup makes you feel good, right? And how about if you don't really know how to put on makeup, what about going to the store and actually getting a makeover or a tutorial, right? Wouldn't that feel good if somebody encouraged you like, hey, why don't you go to the MAC store? Or how about this, even as a coach, right? How about I might be willing to take a day out with you, to go with you. Let's get some facial makeovers. That would make somebody feel great, right? So go ahead and let's say, same client, working with the scarf, she decides that she's, gonna allow you to work with her and help her achieve the goal of getting her makeup done. So now she get her makeup done. What are some of the other things that ladies like to wear?
Jewelry.
Well, not just wigs yet, because we want to work with uncovering, right?
Okay,
Because we want to
okay.
stick with the goal, which is uncovering hair. But you're right,
Okay.
but we want to uncover the hair. But jewelry is definitely one, right? So jewelry, you could have her get her some earrings, a nice chain. You could make it a whole shopping day. And what women typically don't feel good, right? But men, y'all feel good when you look good, don't you? Right? All right. So who doesn't feel good? So those are the things that you can do as a coach, right? And so then you can help them. And so now, do you think that you can also maybe like show pictures, and that's some of the things that you could look at of people, help them to identify? You can make that a homework assignment. Why don't you go back at home, look for a picture of a woman who is completely bald, right? And who has her makeup done really nice and her earrings, her jewelry to match, and find one that you find beautiful. And that's what you tell your client. And then you help them to achieve that goal. And all they gotta do, can you just do me one favor? Let's go out together maybe one day and just see how you feel. They don't have to commit to anything. And if they do, what goal did we achieve?
Covering.
That they uncovered their hair. And so do you see the steps that we worked on to help them to uncover it? And so does that seem hard to do?
No.
It's not hard to do, once you know the steps in doing it. All right. And so there are some things that we can't influence now, but we may influence later. We have to understand that maybe that lady didn't want to go outside because she don't like the way people stare at her, right? And sometimes we might not know what a person is thinking when they're staring. It might be obvious, but we ultimately don't know if they don't say anything. But a lot of it is we assume that we know because of how we feel about ourselves. So now when she goes outside and she feels good and she's rocking this bald head and she's feeling confident because her makeup and her earrings are done, then what happens? If somebody stares at her, how you doing today? And you could teach them how to say things like, I know, I felt uncomfortable too. I used to stare at myself too when I was, when I first went bald, but I look good now, don't I? You have a nice day. That's all. That person might go back and think twice about how they perceive people who has a bald head. That maybe they don't think that everybody who has cancer feel low about themselves, or that is just a negative thing all the time. So that might be something that they can influence later. All right. So any questions, or everybody, are you following? Okay, great. All right. So we're going to do just a little group activity, and this is actually called Out with the Old and In with the New. Okay. So out with the old and in with the new is we're going to kind of do just that. We're going to go ahead and we're going to just identify a negative thought or reaction what can we change, and then a positive thought or reaction that could give them a new way of thinking. So let's just do that. We could take a second or two to come up with that. So somebody just give me, and we could use an example from any of the people that I use. Let's say the woman with her husband. That might be a good one, right?
Mm-hmm.
All right. So what is one of the negative thoughts she might have? Something a little different.
The woman with the negative thought.
Yes,
One
about
of
her
the-
husband. What is a negative thought she might have?
Her husband didn't want to be seen with her,
Okay. Husband don't want to be seen with her.
right? Maybe she thought that he didn't want to be seen with her. Yeah.
Okay.
People would stare.
Was staring at her hair. Well, that wasn't a negative thought. He wanted to take her out, but
Oh wait, hold on, but that's good. I want you to
Yeah,
stay.
but
I want you to stay
yeah.
there, right? So stay right
Yeah.
there. So we're gonna work with that because that's just a thought,
right,
and I'm happy that you brought that up.
right.
He didn't say that. He's
Right.
asking her out. So
But
that
was her thought, though.
that was
That
her
was her
thought,
thought.
right? And so that belonged to her. So what is one thing that she can do to challenge that thought? We have a husband in here. What is one thing that she could do to just try it? Okay, I might have this thought, but what is the step in a positive direction to get away from that thought that she could take?
Her appearance.
Okay, she could, but she seemed to be changing her appearance already, right? But we'll put that, okay, change her appearance. But remember, we want to challenge the thought,
Okay.
right? She's already changing her appearance at the hairdresser.
Right.
But what is something else?
Ask him what he thinks.
Okay. Ask him what he thinks. Okay, so let's say that. So now I have this thought in my head, and the thought is my husband don't want to be seen with me. So then I ask husband, what do you think? I know I'm losing hair right now. I feel like you might not want to be seen with me. Now, these are my actions, right? This is what I can change. I can change the fact that I'm not withdrawing and that I'm actually verbalizing. And so my husband's response might be what?
You're beautiful the way that you are.
You're beautiful the way that you are. And then what happened? I might think, I'm going to go out on a date with him. Right?
Right.
I'm going to go anyway. All right, and so this is one of the activities that you can do with your clients. All right, so the negative thought was that the husband don't want to be seen with her. The change was that she changed her thought. She decided to ask him what he thinks, which is different from her withdrawing. And then her positive outcome is that she thought and her action was, I'm going to go out with this man anyway. And so do you see how you're working with your client to actually achieve that goal? All right. Does this seem like something you guys could do in your profession?
Sure is.
All right. So one of the things that as a coach, I want you to definitely work on with your clients is journaling. That's a goal. You're going to help them when they start developing these positive thoughts, have a thought record, and they could just think about everything. Okay. Journals it's an acronym for judgment free, no judgment on the paper, observation. They're observing the things that's going on with them. They're developing an understanding about themselves and the things that might trigger them. They have revelation to things that they might not have been able to uncover before. They could go through things that still need assessments in their life. Is bringing forth awareness about themselves and things around them, and even the people around them, because in this case, something about her husband. And then it just is something that's beneficial to your life altogether. So we definitely want to encourage journaling. So I just want to introduce you to some of the things that you might see, or just some terms of some people who might be dealing with alopecia. I want you to be able to recognize it even though you're not dermatologists. So you have some people that have chemotherapy or medically induced alopecia. There are over hundreds of medications. It's not just chemotherapy that leads to hair loss, like high blood pressure medications. All of those things actually lead to hair loss. You have traction alopecia. And so this is actually a model, okay? And she has traction alopecia, which is actually seen a lot in African American women because of the hairstyle and choices, especially when they are too tight. And so you see she's like losing her edges. In addition to that, you see she also have fake hair trying to cover it up, but that only, contributes to the issues of alopecia. This right here is alopecia areata, and we recognize alopecia areata because of you're losing hair in certain areas, okay? And this is the onset of alopecia for a lot of individuals. Here go the famous, scarf. So more times than not, we're able to identify that this person might be going through chemo when they lost their hair as a result. And then we have alopecia totalis and alopecia universalis. So as you see, there's a lady here, and we see this a lot of men, because when they get to that point, they might embrace it, who, alopecia totalis, she has total loss of hair on her scalp, right? Total loss. So that's when you lose all your hair on the scalp. Now, if it was universalis, she would have no eyebrows. That's usually a telltale sign. No scalp, no hair on the eyebrows, no hair on the eyelashes. That's usually how we're able to differentiate the two. And they probably have hair nowhere on their body, but this is what's visible to you. And so these are the clients that you will probably see, okay? Now we're gonna use another type of hair loss client just for the sake of class. And this is a client who has trichotillomania, okay? Now this is a client who might go to a counselor more times than not. This person have recurrent hair pulling, people that might sit there and just pull out their hair, and that's actually a condition, okay? We call it trick for short, and they find just areas to pull, and sometimes they do it just because it makes them feel better, okay? And they find a place where they have like heightened sense of sensitivity. Sometimes they might do their hair, their eyebrows, even their eyelashes. Sometimes they do it with tweezers. It might be hormonal, even though they don't know the real cause of it, but they say it might be hormonal because it usually starts at about puberty, which is about 12 to 13 years old. And there is a small pain association, but ultimately it feels good to the person who's doing it. All right, so we're gonna develop techniques for working with a person like this, and you're gonna identify and what leads to them actually pulling. Okay, so is it that you're bored? Do you do it when you're angry, when you feel like you can't express yourself? You want to help them to work on whatever skills they need to, such as assertiveness, develop skills for dealing with anger and anxiety if they need it, goal setting, problem solving, and sometimes even just relaxation tips actually help. All right, and one of the techniques that we'll learn through the program is called habit reversal training, and these are the exercises that will help them to achieve the goal and the ways that we, want to achieve with them, like just hair loss or the things that will lead to hair loss, and then the coping skills for dealing with the things that cause the hair loss. And these are the steps. So you have awareness enhancement. So that's asking the client, do they actually pull, on their hair when they're bored or when they're lonely? You're going to help them to first identify it. Then after they identify it, they're going to practice stress management, like breathing techniques where you teach them how to breathe. And you don't wait until something happens. You have them practice it for the first 3 weeks so that it becomes second nature to them once they feel in those triggers. Alternative behaviors, we're going to help them identify things that they could do with their hands, such as sometimes you might give them a rubber band to pull and have the rubber band pull and snap, so that way they're actually just keeping their hands occupied and not pulling at their hair. And stimulus control, if a person is doing it because they're bored, what are some of the things you could do when you're bored?
Read.
Yeah, you can read or go out with friends or
Phone.
get on a phone, right? And your phone definitely, texting definitely occupies your hand. So those are definitely things to do. So as a group now, this is your activity. I hope that I have prepared you. This is going to be Think, Pair, and Share. What you're going to do is you're actually gonna think of a way a technique that you would encourage your client with trichotillomania to use to keep their hands occupied. So for 30 seconds, I want you to just kind of think on something by yourselves. Then I want you to get together as a group, and I want you to speak about, your options, and then come out with what you think is the best, and then I want y'all to share it with the class. Okay, so I hope y'all thinking on it. Y'all got your thoughts? All right, so now I want y'all to discuss it. Y'all gonna pair together, and then y'all gonna go ahead and share what it is that you're discussing.
I said, since the hair picking begins in puberty, for older adults, we can do crochet, what's it called?
That sounds good, knitting.
Knitting, and then younger people can do manual.
Okay, so I think y'all might have it together. All right, so what did y'all come up with?
Since this hair picking begins during adolescent ages, puberty between 12 and 13, I would suggest that they try to do kind of like lanyard, because you're constantly using your fingers, and it's satisfying.
That is excellent.
It's creative.
Oh, that is excellent. That is an excellent choice. So, did y'all help a client today?
Yeah.
Yes.
All right. I think y'all did well. Have we achieved all of our learning outcomes?
Yes.
Yes.
All right. Do you have any questions?
No.
No.
All right. And that concludes our lesson. Thank you so much for participating.
You're so very welcome.
Okay.